Hearing loss is the third most common health problem in the United States, behind hearing disease and arthritis. Approximately 15% of American adults have trouble hearing, and stats show that hearing loss among adults is on the rise right now. So between more people losing their hearing due to not taking precautions, coupled with age-related hearing loss, this is an area of concern. So today we welcome Dr. Greta Stamper, an audiologist at Mayo Clinic, to talk with us about awareness and helpful hints and devices. So good morning. Thank you for being here.
Thank you for having me.
So let's just start with a basic question. What are some of the most common causes of hearing loss?
So the top two causes of hearing loss are the natural aging process and exposure to loud sounds. 1 in 3 people over the age of 60 have hearing loss, and this number rises to 1 in 2 for those 85 and older. In terms of noise exposure, there are many jobs where workers are exposed to loud noises, and with repeated exposure over time, this can really take a toll on your hearing. Some recreational activities, such as shooting firearms, riding motorcycles, or attending loud sporting events or concerts, can also be potentially damaging to your hearing. Other common causes of hearing loss include taking certain medications or genetic factors that could lead to hearing loss.
Wow, and who is at highest risk for hearing loss?
Primarily the aging population, and this happens younger than you would think, as well as those who are exposed to loud levels of noise.
And when you say exposure to loud levels of noise, I'm instantly thinking about kids who always have their headphones on. Even adults we see blasting their music all the time while they're walking down the street or going for a jog. Do loud headphones, play a role in hearing loss at all?
They certainly can, especially if they are increased to the level that's dangerous, but just listening to them in and of themselves, as long as it's at a safe volume, this is perfectly fine.
So when will you know when you should seek help? What are some of those signs?
One of the most common signs of hearing loss is that you notice people are mumbling or sound is not clear. You might have to ask people to repeat or find it difficult to follow conversation. Another sign is turning the volume up on the television or your telephone. Anytime you notice or your family notices that you're not hearing as well as you used to, this is a good sign to call and make an appointment for a comprehensive hearing evaluation with an audiologist.
And we know recently over-the-counter hearing aids have been approved. Can you explain a little bit what the difference is between over-the-counter hearing aids and versus the traditional hearing aids?
Certainly. An OTC hearing aid, or an over-the-counter hearing aid, is a new classification that just recently became available. OTC hearing aids are intended for adults with mild to moderate hearing loss. They will be available for purchase directly to the consumer, either through an online store or a retail store. These devices are fully self-fit, meaning that you as the user are responsible for setting the controls and the levels, primarily through a smart app on your cell phone. Traditional hearing aids, also called prescriptive hearing aids, are obtained through your local audiologist. Prescriptive hearing aids are programmed by an audiologist based on a comprehensive hearing evaluation, followed by an individualized needs assessment to determine which hearing aids and which features are going to work best for you.
Okay, and how do you decide which is the best for you?
So the best hearing aid is going to be the one that you will wear. There are a lot of really great options out there, and it's all about finding the right match between your hearing loss, what your personal goals for your hearing are, and what you're physically able to manage with hearing aids. There are hearing aids that are rechargeable, that are smaller or larger, that have a lot of different controls, or are fully automatic. Making an appointment with an audiologist to have a comprehensive hearing evaluation is a great place to start to help you identify what the right options are for you.
And Dr. Stamper, before we run out of time, I'm curious to know, is there any way to prevent hearing loss at all?
So the number one way of preventing hearing loss is to stay away from damaging loud sounds. Typically hearing loss, once it has developed, is permanent. However, there are some hearing losses that can be corrected surgically. And again, this highlights the importance of having a comprehensive hearing evaluation or a good baseline testing with your local audiologist.
All right, thank you so much. It was a pleasure having you on this morning. Dr. Greta Stamper, an audiologist with the Mayo Clinic. Thank you so much.
Thank you.